These are the top 5 things I would do if I was in my first trimester of pregnancy and dying of nausea. My name is Lena Marie Gorski. I'm a birth, postpartum doula, childbirth educator, and a mom of 5. So I've been pregnant quite a few times, and I've been dying of nausea quite a few times, 4 times to be exact. And it feels like death. My first tip for you is to eat smaller meals. Trying to sit down and eat a big meal is 1, disgusting at that time, and 2, impossible, because you really can stomach little things at a time. Crackers, maybe rice cakes, things like that. So eat small meals and whatever you can stomach. Like you can make a baby off of Chinese food. I did. She's about to be, she's 13, and that's all I could eat when I was pregnant up until 22 weeks with her. My next tip is to stay hydrated. And this is kind of hard because in the first trimester, water sits in your stomach like concrete, and it's really hard to get down. You're gonna wanna try to drink some fizzy drinks. You can try a lemon lime water, sparkling water, something like that, but they really go down a little bit easier than just a plain water. Electrolytes are also gonna be important at this time because if you're throwing up, you need to put them back in. So think about a liquid IV in your water, think about something like that. Number 3, ginger and lemon. They're very helpful at this time. So any kind of lemon lozenges, ginger lozenges, a ginger tea, anything like that is really going to help you keep things down and keep that nausea down. I, however, am allergic to ginger, so I just kind of lived on things that were lemon. They have these nausea pops that are like a lemon kind of flavor and cherry. You can get them on Amazon. They are somewhat helpful. And also, I believe the makers of Mother's Milk Tea, they also make a lemon ginger kind of candy, and it can be helpful as well. You also need to really rest during your first trimester. That's going to help you as well. If you're trying to push yourself too much, you're ultimately going to vomit. So you need to rest, and you're exhausted. You're making eyeballs. You need to rest. You are creating someone's heart. You need to sleep. So what I want you to do is I want you to send this to your partner, and I want you to tell them to fast forward to 2 minutes and 40 seconds so that they learn that you're making a circulatory system and you need to rest. It's also important to avoid triggers. If there's a food that is particularly making you throw up, avoid it. With my daughter that I was just telling you about that's 13, I could not smell coconut, look at coconut, eat coconut, think about coconut for about 5 years because I tried to force it. Don't force it, because all it's going to do is come back up, and then you're not going to be able to stomach it for the next 5 years. B12 is also something else that can be very helpful for you during the first trimester. If you're going to use anything like B12 or Unisom, which has B12 in it, talk to your doctor first and foremost. These are medications, and B12 is a vitamin, but Unisom is a medication, and you need to talk to them first before using it. There is something that is called pregnancy insomnia, and doctors often prescribe Unisom for that and the nausea as well. So it is something that you can discuss. There are also stronger medications if you are having very, very bad vomiting and nausea. So if you can't keep anything down, you can't keep water down, you're losing weight, anything like that is happening, and it is before your appointment, because now we're not really seeing a doctor until almost 12 weeks, call the doctor. That is important, because maybe it's not just normal morning sickness. Maybe it's something bigger. So you need to call them, talk to them. Maybe you need an IV. Maybe you need something else. This is not just you complaining and not being able to hack it as a pregnant person. This is hard, and there are things like HG that could be causing you to vomit more. Remember, in your first trimester, you are making a human being from scratch. You are making a placenta. You are making organs. And honestly, any nausea you're having is your partner's fault. So be sure to blame them, put your feet up, and take a nap. If you're following me from the first trimester, I really hope that you go back, you look at some of my videos that have to do with birth, postpartum, and everything else. And I hope that I can be a part of this journey with you. And as always, I hope that you birth with a voice. If you have any questions, feel free to leave them below. And if you'd like to join my email list, it is the link in my bio.